Hey guys, it's Dami here and I'm back with another video. Yes, as you can already tell by the title, I'm here to prepare you guys all for your nursing interviews. I'm giving you guys the keys. I'm just giving it to you. In this video, I'm going to tell you guys exactly how to prepare for your nursing interviews. I have talked to managers, I have talked to educators, I've talked to interviewees. I have been interviewed many times myself. So I have a very holistic approach and I'm ready to give you guys everything that I've learned. So without further ado, make sure to like and subscribe and let's get right into the video. Also guys, if you want those tips for the scenario questions, they're coming at the end, so just watch it to the end. Before you guys even go for the interview, think about your resume. First things first. Have you tried to get involved in what you're interested in? For example, myself, like you guys know, I worked in the NICU. Like you guys also know, in school, I didn't have any NICU placements. So what does that mean? I kinda wasn't really qualified. NICU is a specialty that you need credentials for. You don't just do it straight out of school. And I knew that. So what did I do? Because I didn't have that placement, I did my stables course, how to stabilize a baby based off different things. I did my NRP, CPR, but for babies, how to resuscitate a baby, a neonate. What else did I do? I did a breastfeeding course. At the end of the day, as these kids are growing, they're gonna learn how to breastfeed. So I did these little things. I also know friends who wanted to work in the ICU straight out of school. So what do? They took a course. They took an intensive care course. I know a friend who wanted to work in labor and delivery. So what did? They did fetal tracing course. These are things that you do. Even while I was in school, I took opportunities to volunteer in places that would give me the experience. At the end of the day, if you guys know me from Instagram, if you guys don't know, check out my Instagram. I went to Kenya last year and it was not for this job, but I was passionate about working with children. So I went to Kenya in 2019 and I worked at an orphanage and I was working alongside a pediatrician and it was great. It was absolutely amazing. And my passion just showed through my interview based off of the experiences that I had, and based off my resume, they could already see that, okay, she's interested in children. She has tried, she's seeked out multiple learning opportunities, educational and practical. Trust me, you don't have to do it all. There might be way more that you even have to know when you get into work, but just the fact that you are taking that step and trying really helps, and it shows during your interview. Tip number 2, research your employer, the hospital, the environment around, the unit, the work culture, the mission statement. What does that hospital represent? For example, during one of my interviews, I was researching the hospital, and this hospital was all about family-centered care, family integrated care. So I made sure when I was talking during my interview, I mentioned those things. There's always gonna be a set of words that the hospital lives by and therefore all the units underneath it recognize. So look for what that is and use it during your interview. Tip number 3, come with at least 5 examples you know you can draw from. For example, I'm looking at my resume. They have your resume right in front of you. Make sure you talk about your resume. You guys already know what my placements were. You guys know where I've been. So let's do me, for example. What are some things that I'm gonna draw from? I can draw from Kenya. I can draw from that experience. Not only did I go outside of my way to seek that learning opportunity for myself, but I was also in a foreign place. I also worked alongside different people, so that shows teamwork, it shows interprofessional relationships. I worked with a lot of people in a very foreign environment. So okay, so if they ask me about challenges, I can probably draw from that. I also had like a palliative oncology placement when I really wanted a peds NICU, labor and delivery, maternity type of placement. That was really challenging for me, especially at first, navigating through that, drawing from that and finding the positives in that, showing my strengths. Okay, what can I do to show my strengths? Maybe my med surg placement when I had to take on 5 patients and do full care. And then I had to go through different situations where, for example, I had patients who refused to have me as their nurse based off of things like the fact that I was Black. I had to work through that and be professional through that. So all in all, you're gonna have to answer a lot of questions about strengths, weaknesses, challenges, times you've had to communicate effectively, times that you worked with the team. So think about all those experiences and try to find examples for each. And As you're finding these examples, think of times that you were also detail oriented. You had to do time management, you had to communicate effectively, you had to critically think. All these things are what they want to see. So kind of just go in already prepared about what would you want to talk about, what shows your strengths, what were the challenges that you can spin to be a strength, what were the difficult times that you learned from and have developed you as a nurse. What, just try to come with those type of examples. So tip number 4, your nursing interviews are always gonna end with some type of scenario-based question based on what's prevalent in your unit. For example, my unit, the NICU, a level 3 NICU, deals with a lot of neck. So during my interview, they straight up told me, okay, your patient's experiencing this and this symptoms, what do you think is going on? I got the answer wrong, but what they wanted to see, which they did see, was critical thinking. Do I know how to go through the steps? Do I know how to think? And am I confident enough to even have an answer? Am I gonna give up? No, I kept going. So now that you know they're going to tell you what's most common in that unit, oh, I never been to that unit, what do? We're gonna search it up. What's most common in kids, what's most commonly seen in peds units? Oh, tonsillitis? Oh, appendicitis? How do I, what are signs and symptoms of appendicitis, of tonsillitis? For example, labor and delivery, postpartum, what is a big thing about that? PPH, postpartum hemorrhage? Okay, what are some signs of postpartum hemorrhage? What do I do in these things? That's what I would search up. At the end of the day, you're not diagnosing, so you don't know the end all be all, but you need to know what you are looking for. Yep. Tip number 5, at the end of the interview, they're always gonna ask you if you have any questions for them. And guys, like I said, I did my research. I talked to many people before making this video, and one thing that came up a lot is that management is very underimpressed, underwhelmed when you say, no, I don't have any questions, oh, no, I'm okay. Always ask something, show your interest. And here's some type of questions that you can ask. What would you say a typical day in your unit looks like? What do education programs in your unit look like? Oh, now management is like, oh wow, this person wants to grow on our unit. Here's what we can do. Here's what we can offer you now, almost in a sense. What has been your unit's greatest accomplishment? Now the management has an opportunity to brag, almost like they're now impressing you. Oh, we have done this. We are known for this. We are this. Oh yeah? My bad. How would you describe your unit culture? It's really important to me to work on a team where I'm mutually respected. And last but not least, tip number 6, follow up with an email. Again, these are one of the major points that I got from management. It was crazy. I sent an email, oh my gosh, I didn't do no such thing. And honestly, there might be a lot of people out here like, I already do this. But for people who just graduated, didn't really do their research too much, like just kind of knew mentally like what to prepare for an interview and like the examples and things like that. I didn't know all of these interview etiquette. And this is a major thing apparently, like follow up with an email, simple email, thanking them for their time and just letting them know you look forward to hearing from them again. Something simple, very professional. It shows your professionalism, it shows your wanting for the job, and it also shows your respect for their time. Okay guys, now it's time for those tips for those scenario-based questions. Let's go. So the scenario-based questions and the case answer questions are going to be very NCLEX style. At the end of the day, if you decide to go for a temporary license and you won't be writing your NCLEX yet, listen to this video, don't worry, I'm still gonna show you guys how you can answer this question. So yeah, these questions are very NCLEX style. They give you a scenario and they ask for your kind of like interpretation. What do you think is going on here? Basically, what they want to see with these scenario-based questions is critical thinking. They want to see you work through the problem. They want to see you try. They want to know that you know what you're doing and you know why you're doing it. It's not enough to know the answer. You know what I told you before? How like PPHN, neck, burn, stroke, sure. You know that's the answer. Do you know how to get there? That's why I said it's very important that you search up, how do I even look for this? What are signs and symptoms of this? And especially now, okay, so you're telling me hours after your C-section, your fundus is still boggy and you're saturating your pad every hour. What's normal? What's normal? Why is this abnormal? It's not enough to say, oh yes, it's bleeding, PPHN. Okay, how'd you get there? So now what do I assess? Do I go straight to palpation? Do I go straight to auscultating? No. I'm gonna inspect, I'm gonna look, I'm gonna ask questions, especially if it's an adult. I'm gonna ask them certain questions that will give me certain answers. Then I will auscultate, I will palpate, I will feel, and then I will continue to ask the questions to get to the answer that I want. And then once I've done my assessment, if the concern still stands, I will call the doctor. I think it's really important that you guys don't panic and honestly just draw to what you know in school. What are the basics? Literally the basics. If you can just go through your assessment and just show what you'll be looking for in each area, you got it. You really do got it. Even if you get the answer wrong, just try. They don't want to know that you know how to answer their questions. They want to know that you know how to think so that when you're in situations, you know how to work through it. So yeah, as you guys prepare to go into your nursing interviews, I want to remind you guys to go in prepared, go in confident, and be yourself. All right, guys, and that is all for today. If there are any other tips you guys have, or if you found these tips helpful, I want to see you guys in the comment section. Let's talk about it. Let's share. I honestly know so many people that go through the comments and let me know this helped, that helped, that helped. So let's share our knowledge. Okay guys, if you guys want to see what I do on a day-to-day basis, make sure to follow me on Instagram. There you'll see, like, you know, NurseDams, and I'm out here doing my thing. Also make sure to give this video a like and subscribe so you guys never miss another video, and you guys let me know that you like this content and I can come out with more content. Oh my gosh. Okay, gotta go. See you next week Tuesday at 2 p.m. Bye guys. Just see my hair. I can't wait for this video to come out. I actually went hard with it still. I'm not even gonna lie to you guys. I went hard. I went super hard. I went super hard. I went dum 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 with it. Like, look, I don't think you guys can tell because I'm wearing pink, but like the hair is actually like red. Like the hair is like, it's a 33T still. Like, you don't see the transition?